High Country Health and Fitness magazine continues, and we are at Frye Regional Medical Center in Hickory, North Carolina, to share with all of you an amazingly wonderful award that has been awarded to the Cardiac Center here at Frye Regional Medical Center, and it is operated by Dr. Perut, and it is not only is it #1 in North Carolina that you guys are now so pleased to be able to tout and to offer this type of service to your patients, but you're in the top 5 in the nation. So tell us about this program and how you guys have ended up with this ranking and what it really means.
Well, it's really amazing. I mean, we were really surprised to find this out. But this is a national ranking by a company that ranks hospitals all over the nation. And through their methodology, risk-adjusted ranking of cardiac surgery, they found that we're the top 5% in the country.
And how do they base the standards of being the top 5 in the country?
Well, this is from Medicare data from 2007 to 2009, so it's 3 years inclusive. They do a risk adjustment, so sicker patients don't count worse than well patients. It's the same risk adjustment for all the hospitals involved, and they look at mortality in the hospital, 30-day mortality, and 6-month mortality. So it's really a broad outcomes-based model.
So you guys really, have are leaps and bounds above any other hospital in North Carolina with regard to open heart surgery and cardiac care, and in the top 5 in the nation among all of the hospitals that offer this type of service.
It's amazing.
In Hickory, North Carolina.
You wouldn't think it.
Yeah, so now all of these people that have been feeling like they needed to travel to Charlotte or to some of the larger metropolitan areas to be able to get the level of care, they really now need to definitely be made aware of the fact that you guys are way better than any of those practices. Well,
we've been doing heart surgery here for 20 years. We have a very experienced team, and it's not just the surgeons, it's the cardiologists, it's the staff, it's the nurses, the OR scrub techs. We have an extremely stable group of people and a very supportive hospital. And I think, we're small enough, we're large enough to offer all the services that somebody needs when they undergo open heart surgery, but we're still small enough to give them personal care. And that's really the difference.
Right. That makes a big difference with, you go through the surgery process, but you have all the follow-up care that also determines the success of that patient throughout the entire procedure and beyond. So definitely having the supporting staff is important. Now, you've been with this practice for how long?
I've been here 15 years now.
And you trained?
I trained at Duke, and I'm the youngest member of the practice. Dr. Carlton founded the practice 20 years ago. So again, extremely stable. I trained at Duke. Dr. Carlton trained at Cleveland Clinic. Dr. Hannington trained at UNC Chapel Hill with special fellowship training at the Hospital for Sick Children in London. So we have a great staff here. And
you guys have really made an unbelievable effort and succeeded in becoming a top-ranked hospital in the nation. Now, I'm guessing as a physician and a surgeon, you don't really go out trying to win an award. You go out trying to help the patients.
That's correct. We just do the things the same way we always have done them. And it's I'm just glad we're finally getting the recognition, I think, that, for doing things the way we've always done them.
Okay, so as a patient, if you're having chest pains, typically out of the High Country area, you're going to be transported to Charlotte or Forsyth. How would somebody end up coming here to Frye?
We've done a number of patients from the High Country, from Roaring Gap, from Boone, from Linville. All they have to do is, at the time the request is initiated, to request to come to Hickory.
Which is a much closer drive for the family and friends that may be visiting with that patient. It's a much easier access traffic-wise, much better parking. It's just a great facility. And they're still going to have some of that small, comfortable feel, but a top-notch facility.
That's exactly right. If they come here, they have one doctor taking care of all their needs. It's not a mill. We don't rush people through. And it's a very personal care.
Well, and that's great to know. So we now know there are more choices and a #1 in the top 1%, #1 facility in North Carolina and top 5% in the country for cardiac care. So for more information on this wonderful practice at Frye Regional Medical Center, come visit us online or pick up a copy of High Country Health and Fitness magazine.